Hello, I am Christine Trevino. Today I'm going to be assessing Miss, what's your name?
Susanna Smith.
Susanna Smith on her head, neck, face, and lymphatics. And this is my card, my note card, and I'm going to place it right here. All right. Knock, knock, knock. Good morning, ma'am. My name is Christine, and I'm going to be your RN for today. May I please have your full name and date of birth?
Susanna Smith, 1964.
Susanna Smith, very nice to meet you. Thank you for that
You too.
information. So today what we're going to be doing is I'm going to be assessing your head, your face, and your neck. So part of this assessment is just a visual assessment. I'm actually going to be looking at you, comparing shapes and sizes, facial features, things of that nature. But I'm also going to be palpating, which means touching. Do I have your permission to do that?
Yes, ma'am.
Do I also have your permission to video this?
Yes, ma'am.
Wonderful. So before I get started, I'm going to go ahead and I'm going to pull some privacy for us. That way it's just you and I in here, and I'm going to wash my hands with soap and water for 20 seconds. All right, Miss Suzanne. So the first part of this assessment is just a visual inspection. So right now I'm just kind of looking at your skull, the shape of your head, and your shape of your head is round. It's also what we call normal cephalic, which means that it is proportional to your body. The next thing I'm going to do is I'm going to go ahead and I'm going to kind of touch your scalp and your head, and I'm looking for any lumps and bumps.
Okay, would you like me to take my glasses off?
That would be wonderful. Thank you, ma'am. Okay, so now I'm going to go ahead and I'm looking for any of those lumps and bumps anteriorly and posteriorly. I'm not feeling any. Miss Suzanne doesn't appear to have any moles, skin abnormalities, poke out. All right, thank you, ma'am. All right, so the next thing that I'm gonna do is we're gonna go ahead and we're going to assess your facial features, making sure that everything's symmetrical and that everything moves as it should. All right, so please go ahead and raise up your eyebrows and then lower them. Close your eyes, open your eyes. Go ahead and smile real big for me. Beautiful, and then brown. Okay, now I want you to puff out your cheeks like a puffer fish. Very good. All right, so everything looks real good there. The next thing I'm going to do is I'm going to go ahead and I'm going to feel your temporal artery. So all I'm doing is feeling for a pulse. So you're just going to feel my fingers touch you right here. There it is. All right. So she's got a strong pulse. It's a 2+. Now what we're going to do, we're going to assess that. We're going to assess that joint that opens and closes your mouth. Have you been having any pain opening and closing your mouth?
No.
Have you been having any pain at all in your
No.
face recently? Great. All right, so give me just a second to find that sweet spot. All right, go ahead and open and close. One more time, open and close. Okay, so since we're here, I'm going to go ahead and I'm going to assess your lymph nodes. I'm going to see if your postauricular. I don't feel anything there. I'm going to go ahead. And again, Miss Suzanne, if I touch anything and it's tender, you just let me know, okay?
All right.
We're going to look for those jugulogastric right there. The submandibular, I don't feel. Submental. I'm also going to assess for those occipital lymph nodes. And then those posterior cervical. I'm also going to come here for those superficial cervical. And then also that cervical chain all the way down the neck into those subclavicular or supraclavicular. Go ahead and shrug up for me. Okay, good. All right, the next thing I'm going to assess is your thyroid. So I'm just going to kind of squeeze right here and turn right there. All right, go ahead and swallow. Perfect. Okay, so it moves up and down like it should. The next thing that we're going to assess is your range of motion. So what I want you to do is bring your chin all the way down your chest and then look up to the ceiling. Very good. Bring it back center and then look to your left and then to your right and then back straight again. This time I want you to go ahead and shrug up against my hands. All right, very good. And then I want you to go ahead and this time you're actually gonna push, like you're pushing my hand down, okay? Push that down. Good. And then other side. Very good. All right, I'm gonna go ahead and wash my hands again. I'm gonna look at my note card. Okay. All right, Miss Suzanne, so this completes our assessment for today. If you have any questions or concerns, you can call anytime or make a follow-up appointment, and we'd be glad to see you again. Do you have any questions?
No, ma'am.
All right, have a good day.
Thank you.
You're welcome.